Johnson & Johnson announcing today it could test a coronavirus vaccine by September at the latest. The company says they're in a partnership with the Biomedical Advanced Research and Development Authority. Together, they've committed $1 billion to fund vaccine research, development, and clinical testing. Officials think the first batch of vaccines could be available to the public by early next year. Johnson & Johnson says, as the world's largest healthcare company, it felt a deep responsibility to use its resources to fight the pandemic. While face-to-face interactions may be limited right now, doctors still have a way to connect with each other online. Megan Noe shows us how a telehealth program in Missouri is proving to be a critical resource in the fight against the coronavirus.
More than 100 doctors and nurses from across the state of Missouri connecting via computer to listen to expert advice about how to stop the spread of COVID-19.
It's the challenge of the day in healthcare and in our society. So really it's going to take, all hands on deck to meet this challenge.
The University of Missouri School of Medicine is responding. This is Show Me Echo. Healthcare providers on the front lines are linked via video conference with experts from state government, the Missouri Hospital Association, and major hospitals like MU Healthcare. It's a chance to ask questions about all things COVID-19, including testing, treatment options, and the use of personal protective equipment.
When you have something that is this virulent, that spreads this quickly and affects our lives and our economy, you're going to have ongoing questions. And I think healthcare providers now have a place they can go and not feel like they're out there on their own, trying to sift through the information coming in.
Karen Edison is Senior Medical Director for the Missouri Telehealth Network at the MU School of Medicine. She says Show Me Echo can provide rural doctors with the knowledge they need to specifically design treatments for the patients in their communities, an idea known as precision medicine.
They're able to get that information out to their community and to their patients and take better, safer care of patients and protect themselves and the healthcare providers that are there.
Echo sessions will be held weekly as the pandemic continues, providing a template for others around the country.
For Missouri to come together in this way and put on this COVID-19 Echo for all of our healthcare providers, it's a model for other states.
Working together to save lives.
The Show Me Echo program started in 2015 with sessions on a variety of health topics, from opioid use to autism and dermatology. The FDA has issued an emergency use authorization for a pair of anti-malaria drugs to treat hospitalized COVID-19 patients. That will allow for 30 million doses of hydroxychloroquine sulfate and 1 million doses of chloroquine phosphate to be donated to the Strategic National Stockpile. While there are no approved treatments for the disease, federal officials say anecdotal reports suggest they may offer some benefit. Both drugs treat malaria, and hydroxychloroquine is also used to treat lupus and rheumatoid arthritis.